worried about the condition of these young babies. You can see a few behind us, they're quite listless. The mothers keep coming up with quite small babies and telling us how they've got fevers, they've got diarrhea, they're just not well. They're seeing the doctor, but they're very conscious of the fact that they don't have enough water and that the conditions here are very difficult to maintain the health of what are obviously very poor communities to begin with. So these were children that are tiny and have obviously been malnourished from birth by just as an inexperienced eye looking at them. So they're very fragile here in these camps. We need to see what we can do to be improving their access to basic health, to some nutritious food for these little ones while the water levels still recede.
Children, all are malnourished, severely malnourished, and with malnutrition, that's why they are getting chest infection and with skin diseases as well, and some have diarrhea.
I'm here at a health clinic in Sukur, and it just reminds me again of the constant layers that we're facing with this disaster. So for example here, the doctor's telling me he's seen 85 patients, roughly 20 or 30 children, and the mothers and the children especially are all suffering from what he calls basically undernutrition or chronic malnutrition for years, even before this. And so you've got underweight moms, you've got underweight children, and now this disaster, we're lacking therapeutic food for children who are really malnourished. Even if she gives ORS solution, this is the solution that rehydrates children, if they don't have clean water, they can't use it. You're just constantly up against barriers here as to addressing this situation. And obviously chronic poverty is behind so much of this. And so even as we're in the middle of this disaster, it just reminds us, yes, we have to do everything we can to keep people alive, but there has to be a strategy as we carry on to deal with the issues of poverty and how that can also be part of the change that comes in the response to this disaster.